What differentiates an exceptional behavioral health treatment center from another? After speaking to Sovereign Health's Chief Clinical Officer, Dr. Anthony Mele, there's more to it than one might think. Dr. Mele, tell us a little bit more about your background.
I'm a native of Philadelphia, and I guess I've been practicing as a psychologist for just shy of 25 years. And I've been very fortunate in that I've had experiences in both the payer side of behavioral health care as well as a provider. I spent a number of years in leadership at United Healthcare and had the opportunity to also develop several programs on the East Coast for behavioral health. So I've done a lot of entrepreneurial work. It's one of the things that really, I guess, got me excited about Sovereign is it's a very entrepreneurial, dynamic type of company. It's not just sitting on its laurels. It's looking to grow, expand, both clinically as well as geographically.
How does Sovereign continue to grow?
We have a phenomenal team here of clinicians, and that can be a blessing or a curse. And in the case of Sovereign, the way we've harnessed the clinical energy, it's really allowed us to develop a whole realm of clinical programming, from eating disorders for adults to eating disorders for adolescents, even a transgender, gender diversity program for adolescents, a pain management program. So we're not just a run-of-the-mill, static, dual diagnosis program. We are also a mental health program that is separately licensed, and that positions us rather uniquely.
Let's talk a little bit about Arizona. Tell us about Sovereign's facility there and what makes it so unique.
In our Arizona program, we've traditionally worked with women who've had a history of trauma, either sexual abuse or physical abuse. What we were discovering was throughout the rest of our 8 other facilities, there were women perhaps without the documented history of trauma, but who had very similar presentations. They were what we would call emotionally dysregulated to a very, very high extent, a very severe level. So we looked at what programs are out there in the country that are dealing with women who present like this. And these are women who typically will go to a hospital, go to an ER because they've done something, drastic, such as a self-injury, get a lot of medication, are quote-unquote stabilized, and then return to the community. There are very few step downs from a hospital for such women. So we looked to see what's out there in the community and found very, very expensive programs. Out of pocket, no insurance, thousands and thousands of dollars per month. So we said, well, we already have the infrastructure for a similar type of program in our Arizona program. Why not take it the next step? So what we did was we trained all of the staff in dialectical behavioral therapy, or which is also known as DBT, and it's pretty much the gold standard for treating women who have a borderline personality disorder. But we trained everybody. We trained the drivers, we trained the maintenance staff, we trained the clinicians, the nurses, the house manager staff. Everybody got trained in DBT, so that it's almost when you walk into the community there, it's like walking into the Twilight Zone. Everybody is speaking the language of DBT, and the results have been remarkable. There's just this whole consistent approach to the women when they start to escalate, when they start to get out of control, when they start to feel, very afraid and anxious. Everyone knows the proper way, the consistent way to respond. We have a psychologist who roams the community in the evenings, and we have 6 houses, and just roams from house to house to house, supporting the house managers, observing them in what we would call in vivo live supervision of how they're interacting with the patients. It's a phenomenal program.
What's really interesting is how Sovereign continues to help the patient even after they leave. Let's talk a little bit more about telehealth.
The telehealth program is actually an extension of psychotherapy. And our program meets all the HIPAA requirements for security. The issue there is, can we extend the therapeutic relationship that they've developed with their therapist here when they go back to their community, especially if they don't have a local therapist.
Why is it important that Sovereign offers this?
We can't just drop them. No, we give people the choice. It's an option. Do you want to continue with us? Has it been a fruitful relationship for you? If so, this is what we can offer to you, rather than just kind of, discharge you and say goodbye.
Now, Sovereign Health is accredited by the Joint Commission. So what does that mean for the everyday person?
As a behavioral health provider, Joint Commission accreditation is the gold standard that really presents to the public that you've developed and provide a highly quality type of program. For Sovereign, when we look at our third and fourth quarter data from 2016, we were really proud of the fact that compared to our competitors and other Joint Commission accredited organizations, we're within the top 5%. Entering and getting accredited by the Joint Commission is a fairly rigorous process, and it's a standard to which most try to achieve. Not only have we achieved it, our presence within that high organization is at the top. So, I think we surprised ourselves. We know that we felt we were doing a pretty good job, and then to see the data presented as such was really very rewarding.
So what keeps you coming back each day?
My ADHD. The fact that this company is always looking to better itself, to improve itself, to see how we can take neuroscience and turn it into treatment. It's an uncharted territory.
To learn more about Sovereign Health, just go to sovhealth.com.